Hi, I'm Shane Bales, Doc Hockey for Pro Action Sports Injury Clinic. Today we're going to be talking about CARs, our morning routine. So half the time people are warming up before they go to the gym, but it's actually during the day where you're going to probably do the most injury and damage that you need to be warmed up for. So sitting, driving, all those different things that we do on a day-to-day basis as the habits of our workplace and activities. So we always want to talk about bracing, okay? So bracing when we're doing CARs is full body bracing. We're usually doing a higher amount of full body bracing, so about 30% of bracing. So it's not a full out contraction, but bracing. So core bracing, legs bracing. I might even bring my feet in so that I'm bracing in through the adductors. My glutes are tightened, my upper body, so I might even use fists for my hands, and my upper body is tight. And then the joint that you're moving is under tension as well, but it's a lesser tension. So if I'm doing 30% of body tension, I'm doing joint tension of 10%. And the whole reason for that a lot of times is to put more strength into the neck when we're doing these rotations, as well as having more flexibility in the joint and nothing else is moving. So it's very isolated to that joint when we're preparing for that. Okay, so we're gonna go through the whole routine. It should take about 10 minutes on your own if you go through the whole thing. I'm going to be doing a little bit more description, so it'll be a little bit slower doing it, but I won't be doing both sides at all, and I won't be doing the full cycles. And when we're doing cycles, you usually want to do about 2 cycles each way when we're doing it. So let's start out with the neck. So as I stand here, I have my feet, comfortably apart. I'm bracing in through my legs. I'm in through the core. I go through my hands. I'm bracing here, and my neck comes all the way down towards my chin to the sternum here. I turn all the way to the side. Bring it all the way back, nice and slow because you're putting that tension in through the neck, about 10% all the way around. Try not to move a shoulder or anything like that, it's just neck rotation all the way forward, and that's completed. So I do that 2 times one way, 2 times the other time, remembering the bracing. So you're going to be breathing too through your diaphragm, so you're actually getting that, like you're holding your breath, so it's strenuous, and it should feel like an exercise, like you're stressing out a little bit, not just head rotations or circle rotations, because we want to have these big rotations. Okay, so we're going to go into the mid part of the back here. So I'm looking at the mid back here. I might have my hands crossed like so, and then I'm going to the side. So I'm only doing the mid back, so here, so I'm not bending all the way forward. I'm just bending forward here. I come all the way to the side as far as I can. The ribs are going to limit your ability to move, so there's not a lot of rotation there. So I'm coming all the way back here. So I'm extending backwards to the side, all the way to the other side, trying not to lift up any hip or anything else, all the way through, keeping that bracing and breathing through my diaphragm, and all the way forward. So I'd go 2 times one way, 2 times the other way, okay? Now let's look at the shoulder blade here, okay? So now I'm going through the shoulder blade, so I keep maybe my hand against the side here, and the arm can go up and down, but it doesn't go forward or back, okay? And we're focusing on the shoulder blade here to going in a full rotation here, that controlled articular rotations. Okay, so once again, I brace through my hips, my core, my legs, my other hand is in that fist area there, and I'm bringing the shoulder all the way up here. So the shoulder blade comes all the way up. Once I get to the end there, I go forward with the shoulder blade, keeping the hand in the mid part of my leg there, all the way down as far as I can, still focusing on that shoulder blade, coming all the way back, and the hand stays in the middle, come all the way up again, as far as I can, and then returning kind of back to the neutral position, but we want to make sure that we keep doing those rotations, so 2 each way in the circle, so 1 counterclockwise and 1 clockwise with that. Okay, after we've done that, we're going to do the shoulder. Okay, so I'm looking at the shoulder here. I have my hand against the side, and we want to make sure that we're making as big of a circle as possible. So as I bring the hand up, I'm under that, bracing through the body, slow through the hand, up as high as we can, close to the ear as far as we can. Then once we hit that hitch point back here, we turn the hand outwards, right? So this is a really hard one to make sure we don't move anything else. So sometimes we want to rotate our bodies, and I keep turning my hand outwards so that when I finish the movement, nice and slow through here, my hand is actually facing the wall away from me. So my hand is facing that wall over there, okay? And then if I'm going to reverse it, you're going to feel a little bit of a hitch where it comes back here, and then you're turning the arm outwards, bring it all the way up, and all the way kind of forward, just like so, okay? So it's a tricky one, and then you just make sure that we have the hand facing the right proper way if you're going forward or backwards, okay? So we did that. Now we're going to be looking at the arm here, okay? So when we're doing elbow, all right? We have our elbows kind of locked against our side here, okay? We want to bring our arm up, okay? So if we're doing it both together like this, with our palms trying to face outwards. So we want to bring the rotation outwards, or supination if for those healthcare practitioners. Bring it all the way up, turn it all the way out, and you're almost turning around the ulna or the outside part of your arm there, all the way out as far as you can, and then all the way down. So turn, facing outwards, so the light is kind of like your inside palm there, that circle part is actually shining outside of your shoulders. Turn it in, turn it out, nice and controlled all the way down. When we're doing the wrists, sometimes what you want to be doing is looking to put a cell phone or something that you can balance there so that you know that you're not moving any other joint, and you lock it in here. And I'll use this as my balancing, so I know I lock in my elbow against my side here, okay? The wrist, you're gonna get more lateral flexion to the inside or movement to the inside than you are gonna get to the outside with the wrist. So you're here with the wrist, I'm holding that there. I bring it to the inside, I bring my wrist all the way up, so I'm flexing the wrist towards myself, all the way out, and I'm bringing it outwards like so, in, nice and controlled, all the way up, all the way back, all the way to the outside, right? Big circle as much as I can. And we'll go both ways, two sides. And usually I'll do that one and then the other arm, not at the same time like I've done with the elbows in there, okay? So now, as we got through that, we're gonna be going to the lower part of the body here, okay? So we're gonna do low back, all right? So the low back is very similar to what we did with the neck and the mid back. So we're standing here, or we can put our arms across here to help with that core contraction, the bracing in through here. And we did the bracing through the wrists and the elbows, even though I may not have talked about it that much. So as I bend forward, I wanna make sure that I'm bending the spine. This isn't a hip movement, this is a spine movement. So we're bending the spine in the lower part of the back, just through here as far as we can go without pushing out our hips. So we're going out, all the way to the side, as far as we can. This is where a lot of people try to lift up that hip. So sometimes people keep it on their hips like this to make sure that they know if the hip's moving or not. All the way to the side, all the way back, trying to keep only the lower back doing the movement. So don't jut out your hips in the forward, like a pelvis thrust forward. You just want to keep it here, all the way back as far as you can, and then going forward, around, and make sure you're doing it two ways clockwise, two ways counterclockwise when you're doing that, right? The hip, it can be very challenging for people. It's one of the more challenging ones for me as well to do. So with the hip, I often do the inside leg, but I'm going to show you actually how to do it with the outside leg so it's easier to see on camera here. So I'll often have my hand against the wall here for balance wise. I bring my leg up as high as you can, okay? Then you bring it all the way to the outside, okay? So this is rotation outwards. Then I'm bringing the knee, the heel all the way to the ceiling, okay? So a lot of times you want to make sure it's only coming from the hip and I'm not moving too much. I know sometimes we are trying to move, but that's why we have the bracing through the out to keep that joint only in the hip. We move it all the way back as far as we can. Just hip movement. We come back, make sure that the heel is still facing the ceiling or outwards in this case, and then going forward, nice and slow movement, okay? The other thing I want to make sure that we do is when we bring it up high, make sure when you bring it outwards, the knee stays the same height there. A lot of times when people bring it out, they'll drop it down to do this. Once we get here, you're going to be doing that and you're trying to keep it at the same level. So when I bring it up, I bring it back. And you might even feel some cramping in through the hamstring. I know I get it sometimes. Work through it. It's usually not a bad cramp where you have to stop, but if you do need to stop and stretch out, you may do that and then just resume to what you were doing beforehand, okay? So that one's the hip. So now we're looking at the knee, okay? So when we're looking at the knee too, we're gonna do some patellar movements here, okay? So make sure that the knee is kind of straight, because if it's bent, you won't be able to move the patella at all, or the kneecap. So when you have it here nice and straight, and you're just gonna be moving it in usually like a clock. So you have 12, 1, 2, 3, 4, 5, 6, 7, 8, so on and so forth. And you wanna move it each side, right? And each quadrant, so you're moving it up. And you can usually feel if there's a little bit more restriction on one side than the other side, you might wanna work that a little bit more. Okay, so you're getting it all through there. That helps with the fluid underneath the knee when we're doing that. And that's basically one that's not an active movement. Obviously, we're doing that by just putting pressure in a passive way. Okay, so as we do that one, we have our tibia or shin bone here. So this is where our tibia is, and we want to often look at the tibial tuberosity, or that little bump that's on the end there. And what we'll do is kind of mark it off and try not to use any other joints. So I'm here. What we're going to do is be bringing up the foot. We're going to be turning it to the outside. I can feel that bone kind of move on my knee. And then we're going to straighten out the leg. Turn it all the way in now. All the way down. Point the toes inwards, up, up. Straighten the leg inwards as far as we can, all the way down. Point the toes, up, across, down, and really trying to get the knee movement in that big circle kind of area with that. Okay, now with the ankle, often we want to lock out the knee. So we want to lock out the knee there. So it might be easier to see if I'm on the floor here. So if I lock out the knee, right, I can move the ankle. So ankle, we really want to get the eversion or outside rotation there, or inside rotation. That's what we lose a lot with our foot. So we want to make sure we're doing that, so we can lock this out by stopping the tibia from doing more of the motion, or the shin bone here. So as I come out, I'm here, I bring it up, out, down, out, up, in, down, out, up, in, down, and out. I'm still bracing through the whole thing, breathing through my diaphragm to do that, because it's like kind of holding your breath, making sure all the tension is going through there. Your quad is tight, the other leg is tight as well when you're doing that. Okay, so make sure we're doing that. Now, lastly, we did the ankle, the knee, the hip, is the toes, okay? This is one of the more challenging ones for me for sure, okay? The toes, I've had a hard time with it just because I'm a hockey player, I wear hard boots, so my toes don't get the same flexibility as everything else, and they don't get worked individually, and that's what we're trying to regain, and this can help out with arch, balance, and so on and so forth. So I'll have to take off my great green socks, all right? So when we're doing that, we often have our feet all the way up. Okay, so our toes are facing upwards, and we want to do the touches with the outside part of the toes, okay? And then we'll do the big toe, okay? So the big toe comes up. It's harder for me to do that, but I try to keep the other toes up, and we do toe touches down. I usually do about 5 of each, okay? Then we can do the outside where we're fanning them in and then fanning them down like that. So we're doing it individually with that as well. So now that we have them all the way down to, we're going to have the outside ones coming up, coming down, up, and down, and then try to do the outside ones and just bring the big toe up and coming down. Okay, so that's what we're working on with the toes. We do those both sides. You can do those at the same time, but that's what we're trying to accomplish, is getting that balancing, the differential between each joint, and the other joints we want them to work singular as well. So just a recap of what we did here. CARS, controlled articular rotations, is our morning routine. Body bracing of 30% with joint bracing of just 10%. Our upper body is neck, mid-back, then we do the shoulder coming back, shoulder blade around, elbows, wrists. We have the lower body now, okay? So we're looking at the low back, right? Make sure we're doing just the low back. We have our hip after that. We have our shin, where we're trying to move the shin back and forth. Our ankle, looking at eversion and inversion. The toes, separating the toes so that they can work independently. And we always want to remember that we're doing 2 circles each way, so counterclockwise and clockwise, and as big as possible, getting the biggest range. Then you want to make sure that when we're doing a closed joint, that when you're going backwards and you get pain, say, down here, you want to avoid those painful spots, okay? We don't want to work through them. If it's in an open joint, you're going that little bit of pain, that's okay to work through. But we don't want to be putting any more inflammation or going through a spot that's already kind of damaged when we're closing an angle down, so in through here, okay? So make sure you guys are thinking about that when you're doing these exercises. I'll try to post the individual ones, but this kind of gives you a whole flow of how we kind of do it for our morning routines. So I hope you feel better every morning when you do this on a consistent basis. I'm Shane Bales, Pro Action Sports Injury Clinic. Have a great day.